We're going to talk a little bit about Obamacare. Now, Obamacare is the nickname given to the Affordable Care Act, which is a huge law passed in 2010. It's over 1,000 pages long, more than 10 titles, but it really at its heart deals with two very specific issues. The first is, what can we do about the uninsured? Now, about 60 million Americans have no stable source of health insurance. That means that they're at risk of losing their houses if they end up in the hospital, going bankrupt, all kinds of problems. The second issue is that private health insurance, the kind that most people have through their employer, like through Blue Cross or Blue Shield and other organizations, varies a great deal in quality. Sometimes people get kicked off their plans if they get sick. It doesn't cover really important medical procedures, all kinds of issues around private health insurance. So let's draw a circle here to represent how most Americans get their health insurance paid for. So this represents, let's write it over here, 300 million Americans. Now, about half of them get private health insurance, and this is typically a benefit that's offered through their employer. So they get paid wages, salary, and their employer also kicks in money to buy them health insurance as well. So they're covered through that. Now, over here, about this many people, just under a third, are covered by Medicare. Medicare is a federal program. It's health care for people after they turn 65 years old. It also covers a few other conditions like chronic kidney disease, but primarily it's really insurance for older Americans. Now, this piece of the pie here um, uh, is Medicaid, which is a program that is paid for by a combination of the federal government as well as the state you happen to live in. And every state can make up rules about who can and can't qualify for Medicaid. But in brief, this really offers health care to the poor, the disabled, and many children. That leaves this piece. This is the uninsured. It's about 20% of the population, as I said, about 60 million people. So let's come back and say, well, what does Obamacare do for the uninsured? And maybe a good way to explain that is with the analogy that's been used by some economists, which is a stool, the kind you sit on. I'm going to draw one right here, that sits on three different legs. And the concept here is that the uninsured should sit on this stool to offer them stability for health insurance. Well, what are these three legs and how does that deal with this problem of the uninsured? Well, the first part right here is it expands Medicaid. So right here, this program for the poor and uninsured is going to be dramatically expanded so that approximately 20 million more people here could be covered by Medicaid. And the Obamacare says that if you make 133% of the poverty limit or less, no matter where you live in the country, your state should give you Medicaid. In other words, give you free health care. And so that'll cover about 20 million people. Now, for the rest, these are people that are not desperately poor. The government did something interesting. They said, hey, you have to buy health insurance. We're going to create a mandate. But we're going to make that a little bit easier for you. The first thing we're going to do is create this online superstore for health insurance called an exchange. So you have to go there and buy health insurance. And not only that, if you make between 100 and 400% of the poverty limit, we're actually going to kick in some of the money to make that insurance more affordable for you. So that is one leg of the stool right there, that mandate right there. The other leg is that, hey, you know what? We don't want you to be excluded if you have a pre-existing condition or are sick. It's not fair that some people get charged more than others. Everybody's going to be pretty much be charged the same amount depending on how old you are. That is called guaranteed issue. Many people call that the no pre-existing conditions. And it's estimated that that is going to get 20 million other people to get health insurance as well. So this is the strategy for trying to reduce the number of the uninsured, and this is one of the key features of how Obamacare handles this major problem of the uninsured. What about people that are already on Medicaid? Well, it turns out Obamacare is not really going to do that much to change their lives, so we're going to leave that alone. How about Medicare or the plan for seniors? Well, Obamacare just does one really important thing, which is it simplifies their prescription plan, something called Medicare Part D. Bottom line is it's going to make it easier for them to get prescriptions. Now, how about private health insurance? And because this is actually what affects most people. Now, if you have a high quality health plan, it turns out Obamacare is not going to change that much for you. On the other hand, if you had kind of a stingy health plan that really cut back, Obamacare will make some differences. So the first thing is that Obamacare creates an out-of-pocket maximum. In other words, some forms of insurance require you to pay or share a lot of the cost. So it ends up costing you tens of thousands of dollars so that even if you have insurance, you can run out of money and go bankrupt. Obama puts a hard limit on how much that would allow you, how much risk that would put you at about $6,000 for the family. The second thing is that it guarantees that you get coverage for certain, oops, I don't know if I spelled that right. They guarantees you get coverage for certain things like having a baby, medications, mental health care, and a variety of other services that used to be optional. So you will get some care for those issues. The third thing is that it eliminates co-pays for several kinds of visits. So a copay, that's when your doctor's office or hospital says, oh, we need to charge you 10 or 20 or $30 just to come in the door today. Obamacare requires that insurers eliminate copays for like checkups, well, child care, contraceptions, cancer screening. The fourth thing is that you cannot be kicked off. In other words, if you get cancer, need a bone marrow transplant, something like that, the insurer can't say, well, hey, you're costing us too much money, you're out of there, we're no longer going to cover you. It creates that basic guarantee. Now, after all this is said and done, Obamacare is still going to have several problems. Foremost is that the Medicaid expansion through a Supreme Court case was made optional. In other words, if your state doesn't feel like paying a little bit extra to insure a lot of people, even though the federal government is kicking in most of the money, you're out of luck. So if you're poor in one of those states, that is really going to reduce the number, the estimated 20 million people that were going to be insured. It's going to cut into that quite a bit. The second thing is that the exchanges that are created are not necessarily coming online very quickly. So there's technical problems around the exchanges right now. It's still hard to buy health insurance, and it is still could be difficult to afford for some people who are forced to buy health insurance. So as a result, there's still 20 million people here that are not going to be insured, even though they are being asked to buy health insurance. Now, the last thing to cover is how is Obamacare being paid for? It's important to have some sense of this because expanding Medicaid costs a lot of money. Giving subsidies to people who are uninsured to buy insurance costs a lot of money. It's estimated to cost almost $1 trillion over 10 years. It's being paid for by a combination of two things. The first is that hopefully we're going to get better at saving money and reducing costs. So half of that money is going to come from savings to Medicare and Medicaid. That's a little bit theoretical, but that's the idea. And about half of that money is going to come from extra taxes. So there's going to be more taxes on people that are wealthy. Hospitals have to pay taxes. Insurers are going to have to pay taxes. Everybody that thought to be gaining by getting more customers is going to be asked to kick in some of that money as well. But together, these things are thought to make Obamacare budget neutral. In other words, over the long haul, it's felt that Obamacare should not add substantially to the national debt. Anyway, it's a complicated law. We've gone over a lot of material. Thanks for sticking with us today.